I know a diagnosis of epilepsy is scary, but the disorder is actually fairly common, affecting 1% of people, or around 3 million people in the US. Epilepsy is caused by a disturbance of nerve cell activity in the brain. Epilepsy can be inherited, be brought on by an accident, or the mechanism by which it evolves can be unknown. Seizures are a manifestation of epilepsy. In seizures, these seizures will occur over and over. The seizures experienced are typically localized to one portion of the brain, which is usually the frontal lobe, which is in your case. In a healthy, unaffected brain, the balance in excitatory and inhibitory neurons is fairly equal. However, in people with epilepsy, this is not the case. In epileptics, these nerves get overly excited and fire more than they should. And this is how seizures are caused. There are different types of seizures as well as different types of epilepsy, and the type that you have is known as juvenile myoclonic epilepsy. This type is found in around 10% of epileptics. Seizures seen in juvenile myoclonic epilepsy typically present with a long tonic phase, or a phase of seizures where the limbs are stiffened, and this is followed by the clonic phase, where the face and extremities twitch. People with seizures can also have absent seizures, which is characterized by a short loss of awareness, about 10 to 20 seconds. Hopefully for you, this kind of epilepsy responds well to medication and can be controlled to drug therapy, but it is crucial you take the drug every day, as there's a high probability for relapse if the treatment is stopped. While drug therapy is highly effective, the effectiveness of anti-epileptic drugs decreases over time, and retention rates over a long period is around 50%. Another option to consider when treating epilepsy is something called the ketogenic diet, or having a diet that is high in fat, low in carbohydrates. The body burns fat, and the proportion of fat to carbs is about 4 to 1. The mechanism by which this stops seizures is unknown. However, it reduces seizures by 50%. For juvenile myoclonic epilepsy, I would prescribe valproate and see how you respond, and you will take this twice a day with Triggers for epilepsy include flashing lights, loud noises, but they can also be triggered by a lack of sleep or drinking. With this, it is important to stay away from situations like concerts where there may be strobe lights. It is also important to not consume alcohol and to get about 8 hours of sleep every night. The prognosis for this kind of epilepsy is good, although you need to alter your lifestyle and make minor adjustments. However, I need to warn you that in some rare cases, this form of epilepsy is difficult to treat with medications, and in that case, we would follow up and discuss your options moving forward. Cases such as these are rare, however, and many patients remain seizure-free for decades if they are properly treated. A common occurrence with epilepsy you need to be aware of is depression and anxiety. For reasons that are poorly understood, around half of people with epilepsy will experience depression and anxiety. Know that if you deal with either of these, that it is completely common, and you can take drugs to change the levels of feel-good chemicals in your brain and mitigate some of those feelings. Lastly, you may want to consider getting into a clinical trial, which will 1, help scientists better understand epilepsy, and 2, possibly help treat your epilepsy. Presently, there is an influx of research going into the use of medical marijuana to decrease seizure episodes, and these trials are very hopeful. While no subtype of epilepsy is benign, juvenile myoclonic epilepsy is usually very treatable. With proper treatment, you have a good prognosis.